The first topic is, are dissatisfied patients the difficult ones? So let's find out. Why patient satisfaction counts? When a patient is sad or angry, there can occur disputes between the patients and the healthcare providers, leading on to depression of the doctor, or can even initiate violence against doctors. So, according to an article by V. Desai, 1 out of 6 patients are considered as difficult by the clinicians. So, there is this thin line which goes from the sad to the happy end that we doctors as well as the patients want. So, the causes can be patient factors, doctor factors, or the environmental issues. Moving on to patient factors. It can be type A personality or a very stressed patient. When the patient is sad or frightened, a constantly complaining patient, no matter what you do, the patient will complain. A pessimistic patient who expects a negative outcome in any situation, whatever the outcome is. Patients who changes their decisions quickly. So at one point they want a medical treatment, and next step they tell that they want a surgical treatment. So always think before operating on such patients. And patients' education and reasoning also do count. Patients with unrealistic expectations can be difficult to manage. So they want ideal outcome in all situations, whatever the stage of their disease is. A non-compliant patient. A patient who does not take treatment but wants the result. A hypochondriac patient. So that is usually known as Google patients. So they'll be knowing about each modality of treatment, even the research options. Patients who need quick fix treatments or instant results. Patient who wants unnecessary treatments. Patients of pediatric population, especially their guardians, and high profile patients. So these are the subset of patients who demand more. Coming to doctor factors, could be fatigue, defensive in this modern era, angry, or some attitude issues. Environmental factors could be overcrowding of the OPD or the examination room. Language barriers, it is very common nowadays. Monetary problems could also be a. So what do you do when you have a unhappy or a dissatisfied patient? So the step 1 is to recognize such a patient. So you have to look for any anxiety or depression in the patient and build an effective rapport with the patient. So that too, it should be in a limited time. So there is a technique called the BATE method. So BATHE, BATE. So once a patient come in, you have to ask the background, what is the issue. So affect is the emotional state of the patient. How are you feeling? So you ask how are you feeling because you have decreased vision. So trouble, what trouble you are having because of decreased vision, and how are you handling it? And you empathize, give a word of empathy to the patient. So early tuning in and active listening is always the key to manage such patients, and for this step you have to give only maximum of around 1 to 2 minutes. This is a detail of the BATE technique. But you cannot apply this in all situations. You cannot apply it when the patient is having a severe pain or in a life-threatening condition, trauma, when the patient is mentally retarded, or any developmental delay, psychotic patients, and when the patient is hostile. You ask a first B of BATE and the patient gives you a negative response, don't proceed further. You stop at that point. So now you have a history, you have the examination findings, you have reached the diagnosis and the treatment plan. So what will you do next? Step 2 to manage any patient is a pre-treatment counseling. So that is very important before you initiate the treatment. You have to explain them regarding the outcome. what to expect, and if you do not have that expertise, please take a second opinion. And guarded prognosis is very, very important in the present scenarios. You have to explain it if it is required, and pamphlets are a great way of communicating with the patients in the OPD. So if the surgery is planned, always give a pre-operative counseling, that too by the doctor. Okay, you have to give a brief introduction to the OT scenario. The conduct of the OT team is important because most of our patients are operated under local anesthesia. So that is very important. You have to train your staff accordingly, and pain should be managed properly because that gives a dissatisfactory results. So the next scenario is you have treated a patient or you have operated on a patient, but still the patient is unhappy. So what next you will do? Step 3 is post-treatment. So when a patient has a complaint, always believe in the complaint. So some complaints can be genuine. You actively listen to the patient. You think what can be done for the patient. And you have to be composed with the patient, be polite, yet you have to be to the point. And these days, even for trivial issues, the patients might go to the social media. So you have to consult with the experts. And if it becomes a medico-legal case, do get an expert opinion and go in those lines. So that is why you have to always make sure that accurate documentation is important for every patient, because you really don't know which patients are going to turn into difficult ones. Photographs pre-treatment and post-treatment are important. Consent is very, very important, especially a surgical consent should be countersigned by the doctor, and always explain a risk percentage. For example, if you tell in faculolytic glaucoma there is an 80% chance that I may not be able to implant an IOL. So the patient gets an idea in numbers that is a higher risk percentage. So that is the importance of risk percentage, and video consent is also very important. So now we'll move on to each scenarios.
Beautiful presentation. Dr. Greeshma is the faculty of Regional Institute of Ophthalmology, and she has beautifully presented that satisfying a patient is so different from satisfying a dissatisfied patient.